Hello, 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 everyone. I'm Dr. Noelle Reid, family medicine physician and longevity expert at Trinity Health and Wellness Medical Group in Culver City, California. And I welcome you to our live program, Plan, Protect, Prevent Birth Control Without Barriers. So today is about making contraception feel less confusing, hopefully, and more doable. People's experiences with birth control can be really different. Some people may love their method, some have side effects, some are still figuring it out. And all of that is very normal and valid. And so today I am joined by two student ambassadors from Beyond the Sheets, Taylor Black, a senior at Tuskegee University in Tuskegee, Alabama, majoring in education, and Jada Romer, a student nurse at the University of the Virgin Islands in St. Croix, U.S. Virgin Islands. Welcome, ladies, to the conversation.
Thank you for having us.
Oh, thanks for being here and bringing the student perspective, which is so important and so good for us to have and make this conversation hopefully very authentic. So we have a lot to cover. Okay, so let's get into the agenda. Today we'll be covering a wide range of topics related to reproductive health and contraceptive use, including early experiences with contraception and what we wish we knew, understanding your options, strategies to support adherence, navigating access, effectiveness, and personal preferences, and dispelling misconceptions while promoting reproductive health, literacy, and advocacy. So, for many people, starting birth control is really one of their very first medical decisions made independently. And early experiences are often shaped by our friends, social media, perhaps fear based myths rather than data, evidence. Confusion, trial and error, mixed emotions are all normal, and real experiences don't always look like what's in the pamphlet, right? So we have to acknowledge that students often hear about the side effects, the bad things, before they hear about benefits or nuance. So, Taylor, my first question is for you. What were your initial experiences with contraception like, and what do you wish you had known prior to starting contraception?
Yeah, so when I first started birth control, I did hear about the negative side of things before the positive side of things. I think I remember looking up on TikTok, what is the birth control that I can use that won't make me gain weight, that won't make me moody? So I first started birth control to regulate my cycle, and I started with a pill, and I took it regularly on time. But for me, instead of feeling better, I became very depressed, and I didn't feel like myself.
Mhm.
So one of the things that I wish I knew that I know now is that side effects, it doesn't mean that you have to push through, right? I think that you can switch methods and you can ask about different formulas and different hormone levels, because birth control, it should support your body. It should not work against it. And so I think it's important to have a relationship with your healthcare provider so that you can know that you have options and you are allowed to change them.
Yes. All very good points, and thank you for sharing that with us. Side effects are real, right? And we don't have to push through. That's a very good point. We do not have to suffer. So, Jada, I ask you, are there any commonalities here? Anything that resonates with you as well?
Yes, everything that Taylor said was pretty much what resonated with me. Originally, when I started birth control pills without my provider going so much into depth as far as reported symptoms and emotional effects that I can experience, that was a detriment towards myself, my autonomy, and my healthcare. So, some things that I wish that I knew was that contraception can protect you from unplanned pregnancies, but it also can affect your anxiety levels and also how they allow us to regulate our own emotions. So for me and everyone else that I've spoken to, we all respond differently to contraceptions. So some experiences can include excessive mood swings, depression, feelings of disconnect with yourself and others. So a lot of the things that was told to me is that I could have better advocated for myself and further looked into a different form of contraception, and that would have allowed me to recognize my symptoms sooner.
Thank you. Thank you for sharing that. Yes, and you deserve the care where your questions are respected, right? And your choices are supported, and everybody responds differently. So it's okay to advocate for yourself. It's okay to advocate for change. Is there anything else you would like to share in regards to, how you're feeling physically or emotionally with your birth control?
Yes. So as for physical changes, I felt that I experienced a lot of acne flares that did not help me at all with my self confidence and later impacted my mental and emotional well being. This was all happening when I had started taking the pill. So after finding all of these things out, I traveled back to the States and later found a provider that talked me through every form of contraception until we decided on a form that fit my body best. So my advice to anyone that's looking to take this route, you need to date your providers. Find a provider that is both knowledgeable and has the ability to address your concerns and better advocate for you.
That is so good. Date your provider. That's a powerful point. Finding the right provider matters, right? You need to feel heard and seen, and it's okay to switch, and keep moving on until you find somebody who you really feel comfortable with and that you feel is really supporting you. And oftentimes, what I counsel my patients, I let them know this is not a dictatorship, right? This is a partnership. So we're going to work together to get to what's going to be best for you in your life. And that's really what I wish every provider would start with, is what your actual life is, right? So what is going to make sense to insert contraception into your daily life? And so, Taylor, I have a question for you. What lifestyle factors influence the type of contraception that you choose, and what should you consider when choosing a contraceptive method?
Well, I feel like birth control is not a one size fits all situation. There are multiple categories of contraception. There are the pills, the patch, the ring, the IUDs, the OTC options. So I think when you are choosing a method, your lifestyle matters. For example, if you have a busy schedule, if you have like extracurricular activities, if you're a college student, if you travel frequently, then a method that doesn't require daily action, it may better support you. But a lot of the time, I think that effectiveness increases when a method aligns with your real life routine.
Very good. Very good. So there's really no best method, right? And the good thing is that we have a wide range of options to choose. And when we are considering birth control, I think that there are many things we need to take into account, right? And that being effectiveness, access. Do you have easy access to the contraception? Your lifestyle. Does it need to serve dual purpose? Do we need to have not just pregnancy prevention on board, but use this to treat perhaps acne or PCOS, polycystic ovarian syndrome? Or maybe you're transitioning in life, you're perimenopausal and need to have on board for hormone replacement. So many things to consider, including side effects, contraindications. So I kind of like to break things down in terms of looking at the options of hormonal options, non-hormonal options, and barrier methods. And so, in looking at our hormonal options, perhaps short-term options will be the ones that we're probably most familiar with. And Taylor, you mentioned several of them. So, the birth control pill, which is probably most commonly used, the vaginal ring, the patch. So, the contraceptive pill, vaginal ring, patch, in terms of effectiveness, is about the same across the board. So, with typical use, it can range anywhere from 91 to 98% effective, more than 99% effective with perfect use. The birth control pill, of course, is something that you need to take daily. So you have to consider that. Is this something that I can remember to do every day? Um, and can also be used to serve dual purpose, as I mentioned, perhaps for acne management. Maybe we need to prevent cyst formation, or again, we're transitioning in life and need to have on board for hormone replacement. So those are things to consider. The vaginal ring is an option, both combined hormonal method. That perhaps for someone who can't remember to take a pill every day, but they can remember their birth control twice a month, that would be a good option for them, because the vaginal ring essentially is a plastic ring that you would place into the vagina. It stays for 3 weeks. After 3 weeks, you remove. It stays out for a week. That's the week that you get your period, and then you start again for the next cycle. So again, maybe that's easier for someone who has a busy schedule. They can't remember the pill every day. Now, with that said, you do have to be comfortable with your body, right? So you have to be comfortable placing something in the vagina, removing from the vagina, and not everyone is. And so maybe then a transdermal or topical method would be an option, such as the patch. So the patch is typically used where you place a patch on the upper arm, maybe the lower belly, the buttocks, the back. It's one patch per week. After 3 weeks has passed, then there's a patch-free week. That's the week that you typically get your period. So you're having to think about your birth control essentially weekly. Now, in terms of side effects with all of these, probably more commonly what we see is nausea. Okay. But I would say this, that with the vaginal ring and the patch, perhaps less nausea, because we're essentially bypassing the GI tract. An option for those who maybe had issues with nausea with the birth control pill. You can also see breast tenderness, headache, mood swings, increased anxiety, as you mentioned prior with your experience. So those are things to consider with what we consider short-term hormonal options. Now, we have long-term hormonal options, okay? So let's say you don't want to think about your birth control at all. You just want to have something effective and in place, and perhaps and something to cover you for years, right? So for long-term options, perhaps 3 to 8 years, if we're considering something like an IUD versus an implant or a depot, the shot. So for instance, the IUD, Mirena is an example, which is good for up to 8 years once after placement. The Skyla, which is good for up to 3 years for pregnancy prevention after placement. But understand this as well. If you do decide to use a long-term option, it doesn't mean that you're stuck. Okay, so you can have these removed at any point if, say, you are having side effects, just not working for you, or plans have changed. You're deciding to maybe work on baby, and it does not negatively impact your fertility. So even if you do choose a long-term option, you have the option to switch or to change. Now, in terms of side effects, so particularly with the IUD, what you may see is maybe nausea, bloating, breast tenderness. There can be changes in menstrual cycle, which we typically see shorter, lighter periods, and the periods will typically cease. And the Mirena in particular is actually FDA approved to treat other conditions such as heavy painful periods, endometriosis pain. So another consideration if we need to have a dual purpose option on board. Now, the implant is a device that's placed just underneath the skin. So usually in the upper arm, such as the Implanon, Nexplanon. It's good for up to 3 years. Similar side effects with the IUD where there can be irregular bleeding. So maybe spotting in between periods, shorter, lighter periods, or the periods cease. And then we have the shot. Also known as depot, which you may be familiar with in that way. So the depot shot, I would say, and this is my personal um, preference or concern. It's not my favorite. Okay, it's an option. So it is a shot that is given by a provider every 12 weeks. And in terms of side effects, it can cause some menstrual irregularities. So bleeding in between periods, shorter, lighter periods, but there is a correlation with depot and weight gain. So unlike other hormonal options where there shouldn't be significant weight gain, with depot, we do see a correlation, particularly with adolescents and younger women. So if we're seeing a trend of weight gain with depot, that's typically or would be a reason to stop or choose a different method. Now, there's also a correlation or link with depot use, prolonged use, and a loss of bone mineral density. So that's something else to consider. And more recent studies to show a link between prolonged depot use and increased risk for and hemangiomas, meningiomas, I'm sorry. So those are benign tumors of the brain and the spinal cord. So typically for those who are using depot for 4 years or longer, we've seen this increased risk. So for that, I would say that I typically do not recommend for our patients to utilize depot more than 2 years consecutively. Okay, this is a lot of information. So we talked about hormonal options, both short-term, long-term. What about non-hormonal options? So for some women, hormones may not be feasible, whether there be a condition that contraindicates or you just don't want to have hormones in your body. So we do have an option, that being copper IUD or the Paragard, more than 99% effective. It is good for up to 10 years, although can be removed at any point. Now, in terms of side effects, the more common side effect would be heavy, painful periods. So if you do have this at baseline, this would not be the option for you. But, this would be an effective non-hormonal option if that is what you're looking for. And then we have barrier methods. Okay, so barrier methods are a method, but I wouldn't say that they're probably the most effective, right? So that would include condoms. So condoms are great at preventing most STDs, but for pregnancy prevention, there's about a 15% failure rate. So you do have to keep that in mind if that's the sole contraception on board. We also have the diaphragm and spermicides. Again, the effectiveness is not high. So it's about 72, 84% effective. So I would suggest this not being the first go-to, but it is an option as well. So what about over-the-counter options? Because many of us may not be aware of what is available over the counter without a prescription. So one of those things being emergency contraception, such as Plan B. So Plan B is used in the setting where there has been unprotected sex and unprotected act. Maybe there's been a birth control mishap. You need to have immediate contraception on board. So it is a pill, progesterone only pill that we would take one-time use, which is 95% effective in preventing pregnancy when taken within 24 hours of the unprotected act. However, it can be taken up to 5 days after unprotected sex. Okay. Something to consider with this particular form of birth control, though, there is a weight consideration. So for women who are more than 165 pounds, this would not be considered an effective option for emergency contraception. So in that instance, an individual would need to see their provider for alternatives. And the alternatives in this case would be either placement of the copper Paragard IUD or the use of a pill called Ella. And so Ella, which is not a hormone, it is actually a progesterone receptor modulator. It helps to block ovulation. This can be taken within 5 days of the unprotected act. Now, there's something else that is available over the counter that maybe many of us are not familiar with just as yet, and this is the first daily over the counter birth control pill. It's called the O pill. So you do not need a prescription for it. Is a pill that you take every day. It's progesterone only. However, you do have to be on the money with this one. So not just taking the pill every day, but at the same time every day. Because if you do take the pill more than 3 hours late, then you have to use a backup method for at least 48 hours to make sure that you're fully covered for pregnancy. The cost is about $20 for a month's supply. And again, you do not need a doctor's prescription for this. So now, Taylor, I have my next question for you. How do you feel about over-the-counter options for birth control?
My perspective, coming from a college student's perspective, a lot
Mhm.
of college campuses, including my university, Tuskegee University, were located in contraceptive deserts. So getting to a doctor is not always easy. We're about 30 minutes from a doctor's office, and not everyone has insurance money or insurance for appointments or for birth control. So I think over the counter birth control can definitely help because, like you said, no prescription is required. And I think that it's great that it's easier access when it comes to going to a pharmacy, and it can reduce barriers to care. So I think that one thing that people need to understand about over the counter birth control is that easier access does not mean lower quality. You just have to use it correctly, like you said.
Very good point. And at the end of the day, it really is about having access, right? Because we can only be protected if we can have access to what we need. And so, again, I think that having the over the counter options really is removing that barrier. And so you bring up a good point. I think people are not really aware of birth control deserts, that it can be very challenging to have access to effective means of birth control. So now we're going to shift gears just a little bit here. I feel like I've been talking a lot at you and giving you a lot of information, and hopefully you've been able to digest all that we've shared so far. But now I want us to play a little game, what I'm going to call Fact or Fiction. So Jada and Taylor, you are my contestants for today, and I'm going to give you a statement, and I want you to tell me if it's fact or fiction. Okay, so first statement is emergency birth control, such as Plan B, is an abortion. Fact or fiction?
Fiction.
Fiction.
Fiction. Okay, very good. So you are correct. You've been listening. So emergency birth control is not an abortion, right? It blocks ovulation when taken within 5 days of unprotected sex. It will not abort an established pregnancy. So you are correct on that one. Okay, next statement. Hormonal birth control causes infertility.
Fiction.
Fiction.
Fiction. You guys are doing good. 2 for 2. Okay. So hormonal birth control does not cause infertility. There are no permanent effects with hormonal birth control. Okay. So typically the mode of action is that it blocks ovulation. However, ovulatory cycles will return usually within 1 to 2 cycles. So 1 to 2 months after stopping that form of birth control. Okay. So next statement. Hormonal birth control causes weight gain.
Fiction.
Fiction. Okay. So this is true in most cases. So in most hormonal methods of birth control, there is not significant weight gain. And I get this question and this concern often. But with birth control, hormonal birth control, there can perhaps be water weight changes, right? So there could be water weight fluctuations. Maybe we're talking 2 to 5 pounds, which is temporary. It's not fat gain that occurs. Now, that is with one exception, that being Depo, which I did explain earlier. But for most hormonal forms of birth control, there should not be significant weight gain, not fat gain. Okay, and last statement for the game for today, birth control causes cancer.
Maybe.
Not sure.
Not sure about this one. Okay. So I tried to maybe trick you guys up a little bit because this is more of like not a black or white answer. It's not, there's some gray here. So maybe it's correct, right? So hormonal birth control with long-term use can slightly increase risk for breast cancer, but typically in those with elevated risk for breast cancer. So for my prescribing providers, you do have to do a risk stratification, weigh the risk versus benefit and look at the individual. So what are their risk factors? Do they have a strong family history of breast cancer? Are they smokers? Do they drink alcohol, obese or morbidly obese, because these are risk factors for breast cancer, and help that to guide the plan in terms of it being safe for hormonal methods. Now, with that said, hormonal birth control can also have protective effects. So hormonal birth control can be protective for certain cancers such as ovarian cancer, endometrial cancer, colon cancer. Okay, so good to know those things. But sorry, I tripped you guys up a little bit there. There wasn't a straight fact or fiction answer. So, okay, so we've talked about a lot of things, right? We've talked about what our options are, having access. What should you armor yourself with when you walk into the room, right? So when you're going to see your pharmacist or you're going to see your gynecologist or your PCP, there are some questions that perhaps you should have ready for them so that you're fully informed. And number one would be, how does this work? How does this method work that we're considering? If there's a mishap, how do I correct it? How long does it take to become effective? Do I need to have a backup method on board as I'm starting this new birth control, and for how long? What are the side effects? You don't want to be walking in blindly. What you need to be looking out for? Are there any contraindications? So you want to make sure that you give a full history to your provider so they are fully aware of what has been present for your medical history prior, because there could be some contraindications. So for example, if you have migraine with aura, you've had a previous DVT, deep vein thrombosis, or blood clotting disorder, you would not want to be choosing an option that includes estrogen, right? Because that could be a contraindication. Are there certain medications that you're taking that could impact the effectiveness of the birth control? So you want to make sure that you do share that as well with your provider, and that as prescribing providers who are listening, that you get a full history in terms of what medications your patient is on. Cost, right? Because at the end of the day, we're going to be impacted with cost, whether we have insurance or not. Is this going to be covered or not? If it's not covered, what am I looking at in terms of out-of-pocket costs? And understand this too, and I speak to this from personal experience. When you're at the pharmacy and you are getting your prescription, and let's say you do have an out-of-pocket cost, the first cost is not the only cost. Okay, so there are options that could help to get the cost down, whether that be discount cards such as GoodRx, or oftentimes pharmacies will have their own discounts that they can add on to your prescription to get it down cheaper. So always push back. Don't take the first price as the only price. Okay. Now, how do we support adherence? And so definitely for us as prescribing providers who are listening in now, what is important for us to share with our patients? Knowledge is power, right? So what studies show is that when patients understand how their contraception works, when they understand what to do in the case that there is a mishap or they forget, this typically improves compliance and adherence. So we want to make sure that as prescribers, we are educators, right? In addition to that, accessibility. So as a prescribing provider, making sure that perhaps you consider how we can make it easier for our patient to get their contraception. And so writing 90-day prescriptions or even 6-month prescriptions can be helpful if that is feasible. For me personally, what I typically do is write a 90-day prescription with multiple refills so my patient has access to their birth control for a whole year. They don't have to bother me or the office. For a whole year, they have their birth control and can be good to go in that respect. Now, as a patient, as a consumer, what I think is important is to make sure that you set a routine. So you make sure that if it is, say, the pill that you're taking, that you work it into your daily routine, perhaps take it the same time every day so you're less likely to forget. And if you can, set a reminder. So we have access to so many different electronic devices, whether that be our phone, watch, our MacBook or iPad or what have you. You can set reminders to make sure that you're not forgetting to do what you need to do for your contraception for the day. Now, understanding your method and building simple routines, all of that is important. But what about having support? Because oftentimes it is our community as well that we need to support us and make sure that we have the access that we need. And so, Jada, my next question is for you. How do we explore how to find support in our community? How do we build our tribe?
Yeah, so as you stated before, I represent the University of the Virgin Islands, so I'm a proud Afro Caribbean woman. So I want to state that in many Caribbean communities, conversations on birth control, mental health, and reproductive autonomy are heavily stigmatized or avoided altogether. So finding support within your community is heavily essential in helping us to maneuver through the hardships of finding what works for myself and your body. So, Beyond the Sheets being based with Caribbean schools actually works to help us combat this, right? We do this by openly having pair conversations, creating young adult centered spaces, and also giving way to partnerships with culturally sensitive providers. So, doing this work on campus is very much important for me and my peers because it allows us to showcase our talents, but also to have students see that there is growing representation within health fields that will advocate for cultural appropriate care. So, all in all, our work leads to increased trust, decrease in bias, and the ability to learn more in a non judgmental way. Taylor, yeah. So, Taylor, I'm going to turn it over to you and we'll start with our concluding remarks.
Yeah. So, through Beyond the Sheets and our partnership with Power to Decide, we are quite literally changing the culture on our campuses by number one, we're sharing accurate student centered sexual health information and resources. We're not only doing that, but we're creating safe and judgment free spaces for peer to peer dialogue. We're bringing reproductive health conversations directly to our campuses. And by doing that, we're empowering our students to make informed choices and organizing our peers to collectively address and respond to the challenges posed by the lack of sexual and reproductive health services on our campuses.
So beautifully well said, ladies. I love it. So I thank you, Jada and Taylor. We have a few more minutes left for our conversation today. And so I'm now opening the floor to questions. So if any of those of you who are viewing now have questions for us, we're more than happy and welcome to answer them for you. I see one question that's already in the queue. When taking emergency contraception, if you are over the weight limit, because we did talk about this, is it okay to take 2 pills? So the short answer is no. So there's no data to support that if you double up the dose that you're now doubling the efficacy. So I would say in this case, no. If you are not meeting the weight requirement, you will need to see your provider to see what your other options are. And as I mentioned, that may be placement of the copper Paragard IUD or Ella, the pill, the progesterone receptor modulator. But no, you cannot double the dose and think that you'll be covered more so for pregnancy. And let's see, there is another question. Is it okay to use oral contraceptive pill or vaginal ring to skip periods or augment period? So this question I get a lot, guys. And the short answer is yes, you can. You can augment your period. It is safe to do so. You can essentially skip your period. So oftentimes this is also prescribed on purpose in that way. So we can actually, in instances where, say, someone has heavy painful periods, endometriosis, this is one method of treatment or management to skip the period. So it is safe to do so. Now, I will say this, it may be easier for you and less likely side effects if you do allow for a withdrawal bleed. Okay, so you may not want to just do this continuous forever, but perhaps every 3 packs, or if you're using the vaginal ring, every 3 rings, you allow for a bleed. So you allow for that sloughing of the inner lining of the endometrium, because there may be breakthrough bleeding, bleeding that will happen in between time or in between your periods. So it may be easier to manage in that way. But yes, you can augment and it be a safe approach. Let's see. Are there any other questions? Okay, not seeing any other questions for right now. So, okay, I think we're going to wrap things up. So, thank you, Taylor and Jada, for this powerful discussion and for sharing your personal experiences. Thank you all for participating and showing up for us today, showing up for you today, and hopefully you got a lot of good information that you can take with you. I really appreciate your time and thoughtful questions today. For ongoing resources and tips, please follow at Beyond the Sheets HBCU, at Power to Decide. You can also follow me at Noelle Reid MD on Instagram or TikTok. Thanks again to our partners and to Medscape Education for making this possible. I look forward to continuing the conversation. Be well, everyone. Namaste.